this flushing of system that people that people really abuse a lot. Like sometimes you see people who come and say, "I want to flush my system. I want to flush my system."
There's nothing wrong with flushing the system now.
Most times, the idea they have about flushing their system is different. For instance, someone just comes and be like, "I want to flush my system from infection," and that is a very big myth. There's nothing like flushing your system.
But do you understand what the person is talking about or not? So are you trying to say that everything we're consuming within this region of the world is unpure?
You can't ascertain if it's pure. Let me put it that way. You can't ascertain if it's
Even
pure. And then the chemist person rushed drip, like most 2 liters of drip. That could be a risk factor for prostate cancer, food rich in saturated fat, smoking as well. Of course, I earlier mentioned that smoking 45 to 55 years is the average period that a woman is expected to.
there is an amount of time a man should have sex in a month, and when this is not done properly over time, it leads to prostate cancer. All right, guys, welcome to today's wonderful episode on Unfiltered with Mr. Elvis once again. It's really nice sitting before you guys. Today on the show, we have with me a very wonderful young man, a good-looking young man, our guest, who happens to be no other person other than Dr. Odiri. So we'll give him the opportunity to introduce himself properly.
Yeah. So I'm Dr. Odiri Ogenerese.
Okay.
I'm a medical officer currently working in one of the rehabs in Delta State here, a new rehab. And it's a pleasure to be here to talk about the health challenges we face in the country and in the state. Pleasure to be present here.
Thank you, Dr. Odiri. Thank you so much for honoring our invitation and being on this wonderful show,
pleasure.
Mr. Elvis. You're welcome.
It's a pleasure.
What area of medicine do you specialize in?
Okay, for now, I'm a general practitioner.
Okay.
I'm yet to specialize. But as I said, I'm currently working in a rehab to learn 1 or 2 psychiatry skills. Currently working in a rehab that has to do with substance abuse.
Okay.
People abusing hard drugs and alcohol, and learning the medical conditions that can arise from such and how to manage and treat such.
Oh, that sounds very wonderful. So, talking about rehab, we have this stereotype that goes with it that it is only for mad people, only for people mentally unstable. Is that true? How true it is?
No, that's not true. That's one of the common misconceptions we are dealing with currently, because we have now substance abuse is one of the most we call it an epidemic that's actually going on in the country.
When you're saying substance abuse, I would love you to break it down for the purpose of those who will be viewing the show after now, so they can get a clear knowledge of what you're saying. Substance, like what are we referring to when we say substance?
Okay, in layman terms, we mean use of hard drugs.
Oh, hard drugs.
Yes, that includes substances like cocaine, cannabis, marijuana. Currently, there are other synthetic ones made in the lab like ice, methamphetamine, amphetamine, Colorado. So people who actually abuse that, we call them substance abuse disorder patients.
Okay.
So basically, it is not true that rehab is only for people who are mentally ill. It is not true. And that is one of the misconceptions that we are currently facing in the country, because substance abuse is very much prevalent now in the country as we speak, with the increase in promiscuity, hookup culture, and the street culture as we call it. There is now more use of substance among the youths. We currently face that. So I think the notion that it is only mad people, it is not true, because, for example, some conditions can result from substance abuse, like what we call delusion, where someone lacks touch with reality.
Okay.
The person believes, for example, one of them could be the delusion that is associated with paranoia. The person believes that other people are there to hurt him, to harm him, whereas that is not the case. There's also delusion of grandeur, where the person feels like he can do anything, and that he has the ability to to perform. Some people have the belief that they can perform miracles. So these are some of the issues that arise.
Okay.
Also, it could also affect one's ability to make judgment.
So are you trying to say that even anger issue could lead
Yes.
someone to the rehab?
Yes,
If
anger
someone
issues
is
one of them.
too temperamental.
Yes. So we call that a manic. That patient will be termed as a maniac. Someone that has an excessive, burst of anger in response to a particular stimuli. So he's supposed to
Not in
maybe
particular, everything they make am vex.
everything they make can vex basically.
So a person like that can also be referred to a rehab.
Rehab, yeah. And the thing is, most people do not know that they exhibit such symptoms until they meet a trained personnel, a psychiatrist.
So do they really need to be at the rehab to recover from such situations?
No, basically,
Can't you fix it behind the rehab, like at home, and maybe go through anger management sections, or even having those you think that are supposed to be in your rehab? Can't they just go through therapeutic sections in their homes? Must they come to a rehab?
No, that's a very good question. So we have two options for rehabs. We have the outpatient and the inpatient rehabs.
Okay.
So basically, the psychiatrist uses his clinical judgment to determine if a patient would be able to get the best treatment
Okay.
through either outpatient or an inpatient rehab.
All right.
So it all depends on the clinical judgment of the psychiatrist.
All right.
But basically, for milder cases, they can be managed by an outpatient rehab. But for more severe cases or moderate to severe cases, they would actually need an inpatient rehabilitation. That means in a facility for usually up to 3 months for
I
rehabilitation.
have a question now when we're talking about substances. If you're opportune to go outside Nigeria, first of all, let me talk about our environment here. Here in Nigeria, I think we just have general names and we just have general substances like we have the cannabis, we have the ones that are popularly referred to as colos, and we have other hard substances that are being consumed. But if you're opportune to go outside Nigeria, you have the opportunity of seeing that, first of all, these things are legalized, and not just being legalized, they are grouped into terms. They are grouped into medical cannabis and just the regular ones, where you have the one you can take for a particular situation. Like they have the one that is for you being hungry and enables you to eat. They have medical cannabis that will boost your mood, to boost your morale. They have medical cannabis that would also make you sober. Do you understand? They are grouped in different phases. Do you think those ones are not in any way medically advisable, or they are all categorized as not good for the system?
Okay, so basically, the whatever Food and Drug Administration in whatever country knows the harmful effects of substance abuse. So I think it is not completely true that they administer that, but however, because of the peculiarities of the ecosystem over there, they tend to have a system where they purify their drugs better than ours. For instance, they have machineries that can tend to get the purest form of a substance. Whereas in the climes we live in, I think about 2 months ago, we heard that some Mexicans were caught with some Nigerians in a particular state, a particular, I think that should be a Western state, in the bush cooking substances. Of course, that cannot be pure. So, yes, it is true that there are cases where it can be given for clients over there. But at the end of the day, they also know the harmful effects of it.
So are you
But
trying to say that everything we're consuming within this region of the world is unpure?
It's we can't ascertain if it's pure. Let me put it that way. You can't ascertain if it's
Even
pure.
the ones that are directly from the farm, because most of the ones we have, they are directly from the farm. They are being grown.
How sure are you that they are not mixing it with other things?
What could they be mixing it with?
There could be some. There are chemists now that mix things.
They don't mix it. Go.
Oh yes, they do. They do. There are
Wow.
chemists that do that. Yeah.
The only mixture I think I know about is maybe putting a very high grade cannabis and a very low grade cannabis
for the
being
purpose
mixed
of
together so that it will increase sales.
Yes, for
Other
the
than
purpose of
that,
sales.
what could they mix it with?
Okay, so basically, I'm not talking about the natural cannabis. I'm talking about synthetic substances, okay, like ice. It's not, we are not getting the pure ice as we speak, because there are chemists that are now able to just do one or two magical tricks, let me so to speak, let me put, to just produce something that looks like ice.
Okay.
Okay, so those synthetic medications are not, we cannot ascertain if they are pure. We cannot ascertain, and that is one of the issues we face, because currently now they are the cheaper variants of drugs that we have now in this country, and with the economic situation, those are the ones that people now tend to patronize for the purpose of cost, and those are the issues we currently face.
Okay, but one of the reasons I feel people dive into this act is to probably gain themselves. Some people are going through depression, some people are going through a whole lot of situations whereby these substances are the ones that would help them calm themselves. It will help them relax themselves. It helps some people shop. You understand? Different people with different effects.
Yeah, so
Do you understand? So are those also to be ignored and put aside?
no, they are not to be ignored for whatever reason. As far as a medical practitioner, substance abuse is substance abuse, for whichever reason you take it for. Yes, there are cases of people who abuse certain substances because they are depressed, because of a loss, they lost money, they lost a relative. Of course, working in the rehab, I've come across people who started abusing certain medication because they were healed. And so a friend told them that if you take this, for example, crack, if you take
feel
this,
better.
you feel better. And when they took it, they started feeling better. But however, that is not the right medication for that condition.
Okay.
So whatever reason they take it for, it's still an abuse. We have a client who abuses crack as well, because according to him, it boosts his appetite. Where we have multivitamins for that, where we have super vitamins for that can help to boost appetite. So whichever way you want to look at it, it is still substance abuse, because it is not the medically accepted way of treating those conditions.
Now let's leave the substance by the side.
Yeah.
Why would you advise people to come to your rehab? Why would you advise people that are going through these stages to be admitted into a rehab? What benefits do they get from?
Okay. So we basically talk about the outpatient rehab and the inpatient rehab. Currently, what we do is the inpatient rehab.
That's what I want us to talk
For
about.
the inpatient rehab, we would advise that because it helps to create an environment to reduce the dependency on drugs. Unlike the outside environment where the patient comes to see you, you do a drug test, you write some medications, and the patient goes out. There are some patients that wouldn't really be able to have that discipline. Basically, almost every time they will come, it will be positive. So it tends to help them to build that discipline, usually for 3 months, to build that discipline to be able to reduce their dependence on that drug.
But then I know of people that have been to the rehab, and after that period of time, after coming out of the rehab, give them a few months, and they are worse than they went out the way when they went into the rehab.
Okay.
So does the rehab really do good? Because over time, the patients don't really heal. And you can attest to that fact too.
Yeah, I wouldn't really say they do worse. I wouldn't really say that. I would only say that rehabilitation is a long journey. Okay, keeping someone for 3 months, 1 month, it's not a guarantee that the person would eventually stop.
But spending that amount of money, I don't know how much you take in your rehab, but spending whatever amount of money is supposed to be a guarantee up to a certain extent. Okay, so you saying it's not a guarantee, you are not really helping those who want to come inside, because they are spending that money for their own benefits to get out of that situation.
Yeah, at the point, I would say it's not a guarantee, and I also have to stick to that, because if you say it's a guarantee, you are not being honest to them. The bulk of the work actually relies on that person. Okay, what the rehab just teaches you is the ability to learn your triggers. Okay, how to cope when those triggers come, changing your environment, teaches you with the necessary skill. There are medications you are given as well to help to reduce your dependency. But ultimately, the decision still lies on the individual. For instance, if in the rehab you've already been taught that you should avoid certain locations and probably delete the number of your dealer, and you do not do that, that could be a trigger to you. So you wouldn't really say it's the fault of the rehab or the
Some
fault of
people
the
would rather
rehabilitation.
die than for you to delete their dealer's number
So that's
from
what we're
their
talking
phone.
about. So it is not really a waste of money. I wouldn't say it's a waste of money because yes, there are
But
valuable things that have
at
been.
any point, does the rehab give up on patients? Probably
We do
someone
not.
who has been here before,
No, we do not.
out, in again.
No, we do not.
out.
In fact, we strongly believe that the more rehabilitation a patient comes for, the more likelihood for that patient to eventually stop that particular addiction.
Okay.
There are 60-something-year-old people who still go for rehabs. They've been going for rehab for up to like 40 years. Yeah, so we wouldn't discourage
What's
rehab.
the essence? Like, if such a person has been into the rehab over and over and over again, and then there's no result, what's the essence?
Okay, so
Because it's beginning to seem like you're just feasting on that person financially.
no, don't look at it that way.
But then for someone to come into the rehab over
It's
40 years
voluntary.
and then he's not healed, how voluntary can it be?
It's most likely voluntary. Let me give an explanation for that. Let's imagine you have a son, and the son has not done anything for himself. No matter how much money you pour into him, he hasn't been able to do anything for himself. 20 years, 30 years, 35 years, and you know that the reason why he does that is because of the substance.
Okay.
You wouldn't want to leave your son like that. So it's not basically
I'm a very different man.
Oh, probably. But most cases of such people, the parents cannot just give up on their children.
It's not necessarily giving up, but sometimes you allow people learn the hard way and then you help them retrace
What
them.
if the hard way is them actually ending up dying, or probably causing you a lot of financial issues that are even worse? For instance, whether you like it or not, money will still be lost. I don't know if you get.
Okay.
Money would either be lost on the substances themselves, or they will be, I wouldn't say lost, or they will be spent for the rehabilitation. So whether you like it or not, money still would also have to leave your pocket either way. So you just have to choose between the better evil, so to speak, or the lesser evil, or between the better good and the lesser good. So at the end of the day, it all boils down. It's not a scheme to try and siphon money from
people.
No, it's not. It's just one of the ways. Of course, there are success stories. While we look at this side, we also have to look at the positive part.
Will you tell us a few?
Yeah. So there was this guy from Abuja. I came from Abuja all the way to Delta here.
To your rehab?
Yes, to our rehab.
All from Abuja?
Yes, all the way from
But I thought there ought to be better rehabs over there. So why would he?
I really don't know. I think
Meaning
because
he must be doing a good job.
Yeah. So they heard about it. They sent him here, and then he was here with us for about 3 months, and then he left. And then later on, he gave us a call and told us that we called him actually and said he was at church, and that the places that he was taking substances, that with his normal guys and colleagues, that I went there and he started telling them about the negative impacts of substance abuse. That is just one out of many. There's also another guy here in just close here,
okay,
where his uncle came from the US, and then observed that the guy behaves very funny, and then found out that the guy takes a particular substance. I'm not going to, I can't remember now. So took him to our rehab. He was with us for about 2 months, and then he was discharged. And then later on, our HRO was in one particular occasion, and then somebody mentioned to him that there's this particular guy in our area. His name is, so to speak, let me call him for purpose of this, Mr. Peace. Mr. Peace, he has been very calm. He has been very different since he left your rehab. That means people must be doing a good job. So yes, there are success stories, but at the end of the day, as I said, it all boils down to the individual and to the particular system that the person is in. Do you understand? So yeah, it's not a waste of time. I wouldn't want to put that impression around that it's a waste of time.
I like that. So where can we locate you guys? Like within what? If I want to refer someone to your rehab, how can
So currently we are located at Upaka along Udo Expressway. There's a street, Arret Street. Along that street, that's where our rehab is currently located.
All right. So this would be a very good avenue for those who have anybody they want to take to Dr. Ojiri. Contact him. If you cannot reach out to him, reach out to me. I'll take you to his location. While you were introducing yourself a moment ago, you said you were a medical practitioner. And I believe that leaves you with a knowledge of general medical issues going around. So I want to ask, what do you think is one of the biggest medical issues we're facing in Nigeria? Like, how do you define our state of health here in the country?
So there are actually many medical issues we face in the
But what are the
country.
major challenges we have today?
Okay, from the health perspective, I would say one of them is healthcare funding, which is an issue. Currently, we go to many hospitals that they lack certain equipments that are needed for the doctor to function, for the hospital to function, for the labs to function. That's an issue. Also, the fact that there is very little funding means that patients will pay out of their pockets for investigations, for procedures, and all that. And also, another issue we face is the brain drain currently that we're having in the country.
When you say brain drain, what are you talking
Okay, I
about?
was going there, where many doctors that have been trained in the country are all planning to leave because of the economic situation. So you just have fewer doctors with more workload, very little equipment to work with, and that's a very, very big issue that we are facing in the
But I
healthcare
thought
industry.
as a union, you have your, like as doctors, you have your union that's supposed to handle these issues. So why is nothing being done?
Under the issue of brain drain,
And in terms of people wanting, no, not just the brain drain, but in terms of the facilities not being available, the equipment,
it all
and
boils
all
down.
that.
It all boils down to the government because
But that's why we have private hospitals, don't you think?
no, I don't agree that private hospitals should have more equipment than government hospitals. I do not agree for such. In fact, in certain climes, private hospitals, you hardly hear of private hospitals because the government hospitals are well equipped.
But where we find ourselves demands that we do have private sectors to help people who cannot access the government hospitals due to the poor
Which are more
facility.
expensive. Which still boils down to some of the issues we face, which are more expensive. Because let's be very frank, if the government hospitals have those equipments, who would want to go to a private hospital that's that expensive?
Okay.
Yeah, so those are the issues we currently face in the healthcare sector. We have, of course, many more,
But then currently now in this is the year 2026. What are some of the biggest medical myths we have?
okay, one of them I would say is this flushing of system that people that people really abuse a lot. Like sometimes you see people who come and say, "I want to flush my system. I want to flush my
But
system."
there's nothing wrong with flushing of system now.
Most times the idea they have about flushing their system is different. For instance, someone just comes and be like, "I want to flush my system from infection," and that is a very big myth. There's nothing like flushing your system.
But do you understand what the person is talking about or not?
Of course, I understand what the person is talking
So
about.
maybe the person is making it sense.
Not necessarily. That's not the case because we face such issues. There was a situation where a woman wanted to flush her system. I think an elderly woman went to a chemist and said she wanted to flush her system. And then the chemist person rushed drip, like almost 2 liters of drip.
2 liters.
Yes, of drip and then some other things.
Dr. Ediri, 2 liters.
Yes, 2 liters. And then, I'm serious, 2 liters. And then, unknowing to the lady, because it's not a health practice, it's not a doctor, unknowing to the lady that this lady is an heart failure patient.
Oh, wow.
Yeah, so in that moment, the lady was gasping, had those features of heart failure symptoms, and then was rushed to the hospital before medical intervention. So those are some of the issues we face with flushing of system. And now it's an issue because if as a doctor you explain to them that there's nothing like flushing of system the way you think it is, they start thinking that you don't know.
So what's supposed to be the right term for that? I was supposed to express that when we maybe visit a pharmacist and then, or maybe a professional doctor, and then we want to clean up? Because flushing of system means you're trying to clean yourself up internally.
Yeah,
That's what it entails, right?
yeah,
So how are we supposed to let them know that, okay, we just want to do some
so basically what I'm
internal
saying,
cleanup?
basically what I'm saying is that taking normal saline, which is common drip, doesn't flush your system. That's what I'm basically saying.
So what's the right thing to do?
Flushing your system is a myth. That's what I'm telling you.
Yeah.
If someone, for example, what are you flushing first of all? That's the first thing you should ask.
Okay, let me.
If, for
Sorry to
example,
interrupt you. Sorry to interrupt you. But before you walk up to the regular places we do go to, are all these pharmacists close by. We just tell them, okay, I beg you, you get what I feel. I won't flush my system. It's because you are feeling a certain kind of way, which is not normal to you health-wise. You woke up that day and you're feeling dizzy, or you've been studying your body system the whole day, and it doesn't sit right with you. Automatically, you just know that, okay, let me see my docket. Or secondly, let me not even use those pharmacists. In the morning, you see those girls selling agbo. And then those guys sitting by the roadside waiting for them, maybe those builders or handymen. And then they are used to patronizing these girls. They just tell the girl, give me washing and setting. It's the same as flushing of system. You understand? That washing and setting, now automatically when you take it that day, you know that day you are feeling agile for the rest of the day.
I think everything all boils down to
So these are all
what we
myths.
call placebo effect. The feeling that when you take something, you feel better, and not necessarily because because those things are doing the work. We call that a placebo effect.
So are you trying to say it's just a mental
Psychological,
state?
yes. Because for a medical practitioner, when you come, we ask you for signs and symptoms. So, for example, let's assume.
But the doctor would also ask you how your body they do you.
Okay.
Is that not the same thing as you?
That's you. I don't think you are getting the point now.
Okay, make me understand.
What I am saying is that flushing your system is a myth with the way it's been done. You don't use normal saline, drip what we commonly call
So now your point is
like
with the way it's been done, not
yes,
it is not done.
Let me go somewhere. There's something we call detoxify.
Okay.
Where you can detoxify your system, and that's you help to remove toxins. So basically, if there are toxins, let's say people who smoke, there are toxins in your system.
Okay.
Just taking lots of water would help to make your kidneys urinate that toxins. Just taking lots of water.
So let me ask a question. In terms of meeting those girls that say I go on the roadside, taking water will replace the concoction they are giving you.
Most toxins are neutralized with just water. Just taking a lot of water.
Sometimes they mix theirs with gin.
It's alcohol now.
No. And then it does the work. No, I'm saying that because you said most toxins are neutralized with just water.
Yeah.
And them, they don't use water to,
Yeah, so it's a money-making scheme, and being the fact that Nigeria, the level of medical knowledge in Nigeria is very, 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 very low. So basically, people feast on that. Let me give an example. I don't want to look like I'm spoiling someone's business, but you can sometimes hear when people sell certain medications that cures basically everything. There cannot be any medication like that. There cannot be any medication like that that cures everything. You take an herb, it cures everything. It's not like that. Staphylococcus aureus,
I'm not trying to call names, but
yeah, basically, yes. I didn't call him. We don't do that here. So, but basically, we have. These are money-making schemes. These are not people who went to medical school, who know the in and out, studied in and out of the human body for 7 years.
I wouldn't want to fully give you this point because regardless of the fact that you're referring to them as money-making schemes, there are people that have been properly healed from this medium, in the sense that the people applying this technique don't just do it because they want to make money, but they have a certain amount of knowledge that drives them to this. So in as much as they are trying to make money, they are also applying their own knowledge, putting herbs together to help heal a person. Are you trying to?
No, I'm not. I'm not in any way. Casting traditional medicine. But I'm just saying that
we're not even going to traditional medicine. I'm talking about these people in particular. I believe they use herbs for what they do.
Yeah, because basically most medicine are from herbs.
True.
So we know.
I'd rather say all medicine because even the medications we take are
from herbs.
Getting from that.
Right. So basically, there are some that could help. For instance, scent leaf has been known to have some chemicals in it that helps for people with ulcer, people with dyspepsia, or call that dyspepsia. It helps medically.
Ulcer,
Yes,
dyspepsia.
yes,
Is that
yes.
the medical term for it?
For people who you haven't really done a scan for, we call that dyspepsia. To
Do
actually
you want to elaborate on that? No, I want to get it clear because this is probably the first time I'm hearing that
No.
ulcer has a different name. I was thinking ulcer is a medical term, and that's the only name we know it for.
Yeah, so well, it's just the medical jargon, anyways. The layman term is an ulcer, but for us, we do not call something ulcer until we've done what we call there's a particular test where we call it endoscopy, okay, where something is put, through the alimentary canal, then used to view a laparoscopy is used to view the stomach and then see if there are specific places where there are ulcers. So until that is done, we cannot really say someone has ulcer. We use the medical term dyspepsia.
Okay.
So it's just for the medical, it's just the medical jargon, nothing for you to be worried about.
Because I was just, no, I'm not actually worried, but I wanted to know if it gets to the point where you call it dyspepsia, right?
Yes.
Does it mean that the ulcer has aggravated?
No, not necessarily.
It's just a term.
Just a term.
And does not imply the
It doesn't imply the gravity.
Good.
Not at all.
Good. All right.
Yeah. So as I was saying, yeah, there are some leaves that are known, to help for certain conditions. But selling a medication that works for everything is a money-making strategy. Selling an herb rather that works for everything is a money-making strategy. There's nothing I want to tell you because there's even no medication that works for everything. So these are some of the myths that we currently face, that herbs, a particular herb just works for everything. It's another myth that we currently face, in Nigeria as we speak.
What would you then say about those people that think this moringa leaf? I don't know. You're a doctor, so you should know what I'm talking about when I say moringa, because it is generally believed that leaf does almost everything, and then people have proven it over time to be true.
How did they prove it? Was there any research?
I have seen, not medically proven, but I've seen people, they've consumed these leaves and then they'll tell you they are sharp. Do you get?
The same thing I'm saying. Yeah, it may work for some, but we work by statistics. We do not work by should I use the word feelings? We work by statistics, medically proven improvements. For instance, let's assume you suspect someone has a urinary tract infection. You did a test for the person, and then you gave the leaf, for example, and then let's assume you repeated the test and it was positive. Okay, we can say, okay, yes, that's a statistically proven way that it was. But aside that, we cannot really say this, this is something that works for everything. We cannot say that.
All right. All right. So due to your line of, medicine, I would want to believe that you've not been engaged in delivering a woman.
No, I have.
You have?
Yeah.
How does it feel?
It feels
like bringing a newborn baby into this world.
Yeah, it
feels what was the experience? What was your first experience?
Okay, mine was actually a CS that we did for a woman. I assisted the CS, and I can't really remember the first case, but basically for almost all the cases I've had to do with a case of cephalopelvic disproportion where the head cannot pass through, so they have to take the woman to the theater and cut open and then take the child out. And for every time, it leaves me with joy that medicine is not just only about preventing death. It's also about bringing a life to the world, seeing the joy that people have when a life comes into the world. It's something very, very, very enjoyable that I would actually like to experience all my life.
That's a wonderful one. Yeah. That's very good. It's beautiful. I wouldn't know how it feels like because But then, what do you think is the hardest part of your job? What's the hardest part of being a medical doctor?
Okay, for me, the hardest part of being a doctor, of course, it's going to vary with people. But for me, the hardest part of being a doctor is knowing that every decision I take affects someone's chances of living, someone's improvement, or someone's, should I use the word deceleration in health? And that's one of the most difficult thing in making decisions.
Decision making.
Yes, decision making. And that sometimes you also have to be very fast with the decision making in certain situations. You have to be fast and efficient with your decision making because that could be the reason why someone,
saving and
yes,
the
exactly,
losing of a patient.
yes. Then also, another thing is knowing that sometimes, despite all the best interventions you've done, the consultations you've done regarding the patient was
We'll still
probably
end up
still going
losing the patient.
still not losing the patient. And sometimes that's the most difficult part for me to deal with. When a patient dies, as a doctor, you start thinking, what could I have done differently that could probably have, changed the
Have you
situation?
gained such experience before losing a
Yeah,
patient?
yes, I have. So there was a patient that I was managing for. It's actually a very bad case, because most cases that come to the hospital, to the central hospital, are usually very bad cases. So I think it was a case of kidney disease, yeah, and the patient was already having symptoms of end stage kidney disease, like the legs were swollen, face swollen, tummy swollen, you know. Even getting a line was difficult for that patient. I had to use the head for the
Talking
patient.
about, we're referring to the
Yeah,
veins
the vein. Yeah,
for
yeah,
infusing of.
yeah. I had to use the head. You know, were many consultants on the case. Many. In fact, we also involved the interventional anesthetist to come and do a central line. But at the end of the day, we lost the patient, and it's a patient that I got close to
Over time.
because the patient was with us for a long time. So that can really be emotional, knowing that someone you've developed a bond with later dies, and you start wondering, what could you have done better?
But
But
as
the
a
truth is,
doctor,
sometimes, no matter the best decisions you take,
it still
what's
turns out to
meant to
be
be
that.
will be.
But then, as a doctor, do you sometimes look at a patient and say, that would be the best option for this person, so the person will just rest,
Mm,
other than going through the
okay.
series of suffering and all that? Does he ever get to that point for you?
Personally, no, I do not get to that point, because, of course, even if in the case of end-stage renal disease, even though the end of every man is death, let me put it that way.
True.
Every man is going to die at last, but death is not something anybody would want. Everybody would,
No,
want.
it's not necessarily wanting it, but sometimes it's just to ease the person's condition at the moment when you know there's no remedy after
Yeah,
all that has been
but
done.
with medical ethics, we can't do that. In advanced parts, let me not use advanced. In some parts of the world, there's something we call euthanasia, where you see someone has been suffering, and suffering, and it's almost like it's better. The family says it's
Yeah.
better this person dies.
Instead of so far, they may just die, make
Yeah,
it
so there's
rest.
something.
Sometimes we say it to people out of
Yeah,
pity, not because we want them
yes, no,
to
as if we
die.
want them to die. Yeah, so there's a term called euthanasia, where with legally the patient relatives sign to the procedure, and then the medical practitioner gives something for a kind of peaceful
Exit.
exit. But because of the aspect of ethics in medicine, in certain parts of the world, it's not accepted, like in Nigeria.
Okay, we don't do it here in
We don't do
Nigeria.
it in Nigeria. Yeah, so you have, no matter the state of the patient, you also have to do your best.
It has to be natural.
Yes, you have to do your best, and
Keep trying.
yes, keep trying.
Not bad. Not bad. But then that leads me to my next question. Why do people suffer so much at old age? Why do people have so many health complications at old age?
Yeah, so it's just like a machine that you just newly bought. Over time, there's something we call wear and tear. Okay, wear and tear, that means it's not as efficient as it was when you first bought it.
Okay.
Okay, so it's basically the same thing with a human body. The cells, when you start life, the cells that you come with when you start life, and the cells at 40 are not the same. The cells of the kidney, and when you are 10 years, is more efficient than when you're at 40 years, because natural biological phenomenon of wear and tear takes place. So that's something we cannot avoid. But then there are things that we can avoid too, that if we do not avoid, can be something we suffer for at old age. Things like some of our lifestyle, smoking, alcohol. Sometimes the work we do could also be one of the reasons. For instance, people who are exposed to lots of gases that are being fled, toxic gases, toxic environments, they could end up developing some lung conditions in old age. Even people who work in sawmills where the wood flies around, they could be at risk of some lung conditions in old age. Some lifestyle, like people who take lots of salt in their food, can predispose someone to having heart issues in old age. People who abuse herbal medications. Yes, who abuse herbal medications could end up having a kidney issue, in old age, when the kidneys can no longer, excrete
Function.
those, as effectively as when they were younger. So, those are some of the reasons why in old age it's particularly challenging with health conditions.
Therefore, in this regard, what are 3 daily habits you would advise to help us prolong our health or help us, maintain a good health at old age?
So I advocate for 3 things, which you mentioned exactly 3 things that are very helpful to develop when you are young. One, we have to watch what you eat. Okay, we have to be particular with what you eat.
Okay.
Yeah, so of course, enjoy life, but reduce your alcohol intake. Avoid smoking. We usually preach avoiding smoking.
Okay.
Because it's a risk factor for many things: kidney issues, heart issues, cancers. Name any cancer, smoking is almost always associated with it.
Seriously?
So, yes, name any cancer, smoking is almost always
So
associated
most
with it.
cancerous patients were old-time smokers. Would
I
you say
wouldn't say
that?
most, but I would say smoking increases the risk of someone coming up with a cancer.
Oh,
Yes, because the toxins that are being released are what we call carcinogens. They are cancer-causing organisms. So it's a very
so
it's
it
a very
exposes your body system to those cancerous cells.
yes.
Okay.
So watching what you take into your body is very, very, very important. Of course, for people who are like 30 and above, we usually encourage them reducing their amount of a red meat. That includes beef. Also, we're reducing pork, foods that are rich in oil,
and
porks, palm oil as well. Okay.
Uh-uh.
Yes, groundnut oil is a better alternative when someone goes, to that age of,
I
let's say,
thought,
40 to
okay,
50.
I'm not trying to, carry rumors around, but from conversations over time, I thought they say palm oil was better than ground oil because
For sight,
frying
for sight,
just for sight.
for sight, it's better because it has a lot of vitamin A. Okay, but I'm talking about for people now who are like nearing that 50, 50. So I'm not talking about people like us. We are still very young. But for people who are nearing 40, 50, it's advisable for them to reduce,
Palm
the
oil.
amount of saturated fats in a group. So that includes palm oil, that includes pork, that includes I mentioned something before. So saturated fat basically is something we advise. Yes, we do not say you should. I'm not saying stop. I mentioned the word reduce
Okay.
your intake of those So that's the first thing I mentioned. I think it's just one I've mentioned. Secondly, sleep well. Yeah, because sleeping is a natural process that helps in healing. People do not know that sleeping is a therapy. Okay, and sleeping helps your immune system. It has been found that people with poor sleep tend to have a reduced immunity. Sleep tends to reduce one's ability to fight infection. Lack of sleep.
So there's not like oversleeping.
There's something like oversleep. Of course, there's too much of everything.
So where do we stand? Now you're saying
So
sleep
we
well.
usually,
Now you're saying there's something like
very good question.
oversleeping.
Yeah,
Where
very
do
good
we
question. We
stand?
usually recommend about 7 to 8 hours of sleep per day.
So
Some
anything
say 6 to
above
8.
7 to 8 or 6 to 8 now is regarded as oversleeping.
We call what we call hypers. There's a medical term for it. I actually skipped my head. There's something we call hypersomnia, something like that, where
Okay.
someone we see it as a psychiatric condition where someone sleeps too much. Can be a psychiatric condition. But healthy sleep
No,
is usually
I'm
recommended
I'm
about.
talking about there are people that naturally like sleeping, not even when someone sleeps too much medically. This is just the person's daily habit. You see, the person, I'm an introvert and spends more hours of the day indoors sleeping, and then when they wake up, they're on the phone, do a few things, and they want to relax again.
Yeah, I don't recommend that extent of sleep, because you also need some level of activity. You get, so you also need some level of activity. But would say healthy sleep recommends 6 to 8 hours a day. Now, that
For
doesn't
an
mean nine. It cannot
individual.
be so. Yeah, for an individual, 6 to 8 hours a day.
But sometimes growing up and then getting involved in activities, because the more you grow, the more tedious and cumbersome your activities tend to be. Sometimes you don't even have the luxury of time to sleep for that long. Does it mean you sleeping for probably 4 to 5 hours will take effects over time?
If that is an habit, if you do not have time for relaxation, for recreation, for making up the times that you do not have those good sleep, of course, it's going to be an issue for you in old age. Of course, it's going to be an issue for you. So, of course, there are times where, even I as a doctor, night shifts, you can barely sleep because the cases are so much. You go home, and then let's say you go home by, let's say by, sometimes we run almost like let me use, we run a whole day and then run half of a day. That's 36 hour shift, and then you have to go home and come back again the next morning. So it can be really tedious. But notwithstanding, you also need to make up a time to make sure you pay that sleep debt that you owe, because if you do not, at the end of the day, it's still not best. It's not an excuse. That's what I'm saying.
All right.
You also have to make up for it.
All right. So at this point, I think my interest is going to
Thirdly, I forgot to mention one. I mentioned eat well. I mentioned sleep well.
okay. Thirdly,
Eat well, sleep well,
you
and
said exercise.
exercise. Okay,
Yeah,
so
you said
those are the three.
exercise.
Okay.
Okay. At this point, my interest is facing towards we the men. There is this thing I noticed that men do suffer at old age, prostate cancer. Okay. You wish, I believe, as a medical practitioner, you'll be very knowledgeable in that aspect. What do you mind telling us about prostate cancer? Can you enlighten us some more?
Okay, so it's a very wide topic,
Yeah,
but
but just
the
the
prostate,
preamble.
yeah, the prostate is an organ.
Okay.
It's both a muscular and an endocrine organ, so to speak, that is located just between, just underneath the bladder in a male, just located in a male.
Yeah. I know you might be wondering why I'm asking about prostate cancer.
Yes.
It's because we're talking about illnesses that people go through
At old
at
age.
old age, and
Okay,
prostate
okay.
cancer tends to be one of them. That is
Yes.
where the question is
Okay, it's coming from.
originating
Yeah,
from, not
yeah,
because I am just vaguely
okay,
talking about
okay,
prostate
okay.
cancer.
That's fine.
It
That's fine.
makes
Yes,
sense
it
now,
makes
right?
sense. Yeah, yeah. So, prostate cancer is one of the issues that people now, it's now becoming rampant. I wouldn't
Okay.
say rampant, but
What is the cause
it's
actually?
now becoming more detected in
What's the
our.
cause? What's leading to it?
Okay, so I wouldn't particularly put a cause to it, because as it is, there's really no specific cause of cancer, of any cancer that we can speak. We can, however, say that there are risk factors that are associated with a cancer. Because if you put a cause to it, it means that everybody who has that particular thing will automatically
Was
come with.
led by
Yes.
yeah.
So we usually use the word risk factors,
All
okay,
right.
of it. So we have what we call the non-modifiable risk factors. Those are things that they are not under your influence to change. One includes family history of prostate cancer. So for people who, perhaps, especially for first degree relatives, their father, their brother, or maybe a son has prostate cancer, there is more
Every
likelihood
tendency.
for that person to come
So
down.
the moment it's in the family line,
There's more likelihood.
you should wash out.
You should watch out.
Wow.
That's one.
Okay.
Then also another risk factor is age, that you cannot actually change. For some people, age is a
But
risk
not
factor.
all old people
As
have
I'm
it.
saying, it is not a cause. You use the word risk factor.
Okay.
You get? So it doesn't mean that everybody who grows up in a family that have prostate cancer will have
Mhm.
prostate cancer. So it's not necessarily a
Definitely.
cause. It's just a risk factor. So age, family history. Okay.
Okay.
Then some genetic mutations. Some people, they do not really have any history of prostate cancer in their family, or not even age related, but for some genetic mutation during their conception, they just tend to inherit a gene that predisposes them to prostate cancer. So that's without the person's influence. But
Alright.
that's the non-modifiable. Then of course we have the modifiable, the ones that we can do to try and prevent the us from having prostate cancer, and that one includes one, the kind of meals we eat. For instance, I mentioned food meats rich in saturated fats.
Yeah.
Yeah, so that could be a risk factor for prostate cancer. Food rich in saturated fats, smoking as well. Of course, I earlier mentioned that smoking is almost associated with.
So inside prostate cancer against
Yes. Smoking is almost name any cancer. Smoking is almost
a
associated with
factor.
almost all cancers.
Wow.
Yes, because as I said, there are some carcinogens, things we call carcinogens, cancer-causing agents. We call them carcinogens that are present in those substances that are not smoked. Yeah,
Cancer-causing agent,
yeah,
carcinogens.
carcinogens. Yeah,
Okay.
yeah. So those are the modifiable risk factors.
Okay.
Smoking, kind of diet. Some would say sedentary lifestyle, but it's neither here or there.
All right.
Yeah.
But then, from a layman's perspective,
Mm.
I'm not a medical practitioner like yourself. So, from a layman's perspective, and the little I tend to know, I have learned that prostate cancer is also being caused from lack of sex. Yes. How true is that? Because I was going through a medical podcast recently, and would I say the host or the person who was talking about it said there is an amount of time a man should have sex in a month, and when this is not done properly over time, it leads to prostate cancer. So, is that also a factor, or is just
Okay, I think what the person might be mentioning is another form of prostate issue we call BPH, benign.
that's not even
That's
prostate
not
cancer,
cancerous. That's not cancerous,
but it's
but it
also
comes with its own
prostate
issue. It is a
related.
prostate-related issue. Benign BPH, benign prostatic hyperplasia.
Okay.
Yeah. So just like in women, where it's said that women who have not been pregnant tend to have an higher risk of coming down with fibroids. So similarly, there are some studies that have hinted that for men who do not engage in regular sexual activity may come down with BPH.
All right, Dr.
Okay.
Ejiri. So now I'm putting it directly to you and I'm asking you outrightly, are you trying to say that the stereotype of having sex inadequately
No,
during the month does not lead
it
to
doesn't lead to it.
prostate cancer?
No, it doesn't.
Because this is a very
Yes.
vast topic out there.
Yes, and even some husbands
some
use it for their
people say you
wives.
need to have sex as a man
They
21
come
times
there.
in a month. You understand? 21 times in a month.
No,
If not, over time you develop prostate related issues. So that's just another myth.
Yeah, that's another myth. Yeah,
Wow.
it's another myth.
Okay.
Yeah.
But I'll hold on to it, Sha. Definitely, I'll hold on to it.
Yeah.
But regardless of that, how could we avoid these prostate related issues, whether the cancerous part of it or just the general medical aspect of it?
Yeah,
What could be
so-
done to avoid it, especially at old age? Because as men, we're getting to that stage in life. Over time, we'll all get there.
Yeah.
It is a good thing we know how to avoid it beforehand, so we'll save ourselves.
Yeah. So that's a very good question, because it's something that we can, I would say, prevent to some extent. That's the modifiable, the ones we can modify. Diet, as I've mentioned, and I mentioned something like smoking. Those are things that we can do. Then also is the fact that we as men have to be more particular about our health.
In what way?
Men generally, we are not as health seeking as women. We can have a complaint and we just see it as normal. But for instance, one, when as a man you find out you go to the toilet, you want to urinate, but it takes time for that urine to come out. It's not something you should treat as levity, with levity. Or let's assume you urinate and then it stops, and then you have to force yourself again for it to come out. It stops.
Gradually.
Those are the early signs of a prostate issue. So as men, we need to be more health seeking. Whenever we have these urinary symptoms, we should meet a medical practitioner
Immediately.
Yes, immediately, to assess us and tell us if we also need to do that. Then also for people who have a family history of prostate cancer or any prostate issue, that's the BPH I mentioned, they also need to even be more proactive, to go to the hospital. There are some screening tests, one we call PSA, that a doctor will recommend after asking some symptoms. You may ask, okay, do a PSA, we call that a prostate specific antigen, that the patient will do, and then tell if the patient is having a higher risk of actually coming out with prostate cancer or not. That's one thing that can also be done.
All right.
I think that would
help.
Yeah, that would help.
Okay. But then generally, what are some illnesses that men tend to experience at old age?
Specifically for men?
Yeah, specifically for men.
Okay. They are more for women than men, but I would say this prostate issue we have, prostate cancer, then the BPH that I mentioned. Yeah. Then
else?
also, it's common to both actually. What we call osteoporosis, where the bones are weak.
Yeah.
At old age.
That was leading to the bending.
That's part of what leads to the bending, because both the vertebral bones, all of that, they are weak. So you have to you have to support yourself by hunching your back. So those are some of the issues that men face in age. Of course, there are many issues, but we are really not that peculiar to men.
All right.
In old age. Testicular cancers, but still rare. Testicular cancers are one of the things. They are also
now let's
visit
the women for a while. Let's see in their aspects in terms of not necessarily old age, but something they tend to also experience as they age.
Yeah.
It is not meant for the very old women. Okay. It is a process that takes them there. I'm talking about menopause.
Oh, menopause.
You can really understand what I'm talking about. That's something that older women also experience. Why? Yeah. Why does it come with a whole lot of health issues?
Okay, so menopause. When we say
First
menopause,
of all, let's break it down for us. And at what age?
Okay.
Is there a certain age?
Okay, there's usually a range. There's no age, but first of all, I would like to say menopause is what we call a permanent cessation of a woman's menstrual period. That means the woman will not see her period again. Permanent cessation of a woman's monthly menstrual cycle. And usually we make that diagnosis after 12 months of consecutive 12 consecutive months of not seeing her period, because there are times where a woman may not see her period for 2 months, and then it sees her period and then it skips again for like 3 months. That's not menopause. So menopause is what we term the complete cessation.
I think from my own knowledge, as referred to as that's hormonal imbalance that causes it for them,
that can be a cause
through their
that can be a cause.
Measure flow.
That can be a cause. Yeah, that can be a cause of it. Yeah. Yeah. So that for menopause, you said why it causes some health issues. Is that what you said?
Yeah. At what point does it begin in a woman?
Okay. At what point does it begin in a woman? So usually there's a range between 45 to 55 years. 45 to 55 years. That's the range that.
So does it mean that
people expect
lesser than that, like women that are not up to 45 cannot experience it?
No. That's what I'm saying. I was actually going somewhere. There's a range. 45 to 55 years is the average period that a woman is expected to
experience menopause.
But for some women, it can come earlier, and then for some women, it can come later. So for some women, it can come before 40 years, from 45 years rather. For some women, it can come,
can it 30? Can 30-something years old experience?
Yes.
38 years,
yes,
39 menopause.
Yes.
What are some
Okay.
symptoms? How would they know when it's coming? How do you feel it? Because for men, you told us the break in your urine
Yeah,
is a symptom which I
yes,
now have
yes.
as a knowledge. So what
Okay,
are
as a
for
knowledge, I
yeah,
thought you said as a
I
symptom.
now have that.
Okay, so for women, um, for some women, they may not really have
Symptoms.
like yes, magical symptoms. Aside the fact that they don't
No, not
see that.
necessarily magical, but at least
When I
visible
say
symptoms.
magical, I mean like apparent symptoms. Aside the fact that they don't see their period, but for some, they may start having what we call hot flushes. Hot flushes. So let's say at
What are those? What are hot flushes?
yeah, I want to explain. Let's say, are you having it?
No.
Let's assume at certain times of the day, they just have that sudden, like a fever, sudden hotness of the face, of the neck, the chest, so hot to last for a while and then it will go away. Okay, so that's one of the things that they can have, that hot flushes. It comes and goes, and that's because for these women, their estrogen levels are now beginning to fluctuate. We usually call that period before menopause, we call it the perimenopausal stage. So
Wow.
they come with those hot
So when they
flushes.
experience these hot flushes you're talking about, do they need medications to go through the process?
It all depends on whether it's
Severe.
severe, yes, whether it disturbs them. Okay, so and basically there are also some things there's some lifestyle, there are some things you can do that can help to reduce it without medications. Such as one, putting
Avoid
on light
smoking again.
clothes. Light clothes.
Okay, smoking is not part of this one.
Avoiding light clothes.
Okay.
Sorry, using light clothes rather.
Okay.
So not wearing thick clothes. Or if the weather is so hot, instead of putting on a thick cloth, you dress in layers. So you can put a light cloth under, then something on top.
You're talking about just the normal dress they're wearing.
Yes, it
It's
can
having
help.
effects in terms of menopause too.
I'm talking about for the hot flushes.
Oh,
You try
okay,
and
okay.
reduce the hot flushes you get. So
Okay, I'm getting it now.
putting on light clothes will help to reduce the occurrence of those hot flushes. Then if the weather is cold, you probably have to. You have a question. The weather is cold, you probably have to, you know, dress in layers. Okay, so instead of just wearing a very thick thing, you can just put on something light, then put on something on top of it, so that when the weather when you get the hot flushes, you just pull the outer layer of your.
So it has to do your body temperature.
There are many triggers. One, heat is a trigger of those hot flushes too. So for some women, eating spicy food tends to trigger those hot flushes. Yeah.
Let me get something clear. Are you telling us symptoms, or you're telling us ways we can probably avoid?
Yeah, you asked me what can a woman do to manage these symptoms. I think that's what you asked me. And I mentioned one of them was hot flushes.
Okay.
Yeah, and I was saying for that hot flushes, that can be done because basically that perimenopausal stage, that estrogen I mentioned helps the body for ladies to regulate their temperature.
Okay.
So because it's now fluctuating at that stage, the body does not really know, or the body does not really have that mechanism intact to regulate their temperature as fast as possible. So if they are exposed to extreme of temperature, let's say the weather is so hot, it comes. If they take some food like some spicy food, it can come. So there are some meals that they can take that.
So with these things, they can control.
Yes, they can. Yes, just a woman to watch her triggers and then avoid them.
Wow.
Yes. Wow. Then also other issues that comes with menopause are that what we call breast tenderness.
Okay.
Yeah, those are some of the issues that
but why does it carry so much complications?
The menopause?
Yeah,
It's because of the hormones.
Can they not experience the menopause without those numerous health issues?
As I said, there are some women that they don't. It's all boils down to individuality. Yes. Okay. There's some women that wouldn't actually have these.
You wouldn't
Yeah.
flinch. It's just like a normal day-to-day life for them.
There's some women like that. Yeah. Just just goes through that stage of missing it for 2 months, then coming back again. That's the perimenopausal until suddenly it just stops for about 12 months and then it goes on like that. So for some women, they don't have symptoms.
So when it stops for 12 months, meaning it's completely gone.
It's completely gone.
And there are no chances
that
there are no chances of taking in.
well, a doctor has to be the one to make a diagnosis of menopause, because
why?
a doctor has to rule out other causes that could make someone not see a period for 12 months.
Why I'm asking, because if you tend to look at the age range with which women do experience menopause, we would say from, according to what you said, you said from 45
to 55.
55 and above.
Yes.
But then we've seen women even at old age, they do take in, they have children.
That's what I said.
So
That's
that's what I'm
late.
trying to ask and be clear on it. Is it that even after this stage of menopause, a woman can still take in?
For a woman to take in, it means that the woman sees her period once in a while or every month.
Oh, that's also possible even after menopause.
No, it's not. That is not menopause. That's what I'm saying. So I'm saying that what I'm saying is a doctor has to be the one to make a diagnosis of menopause.
Okay, not you saying to yourself.
Not you saying to yourself, because yes, while there are some symptoms that show menopause, there could be other causes.
Okay.
Do you get? There could be other causes of why a woman wouldn't see her period for a period of time.
And now, Dr. Odiri, I'm asking a straightforward question.
After menopause, you do not see your period again.
So you cannot take in.
You cannot take in again.
You cannot birth a child.
You cannot birth a child again.
Wow.
Yes.
Okay. Fair enough.
Yeah.
Fair enough. But then, other than menopause, which other illnesses are women prone to at old age?
Okay, at old age, one would be osteoporosis that I mentioned, which is more in women than men, where the bones are weak. Okay, because of course, those hormones I mentioned, they are very important in strength of bones in women. So when a woman reaches that perimenopausal period, the bones tend to become weak. That's one. Also, other issues could be things like some cancers, like breast cancers, ovarian cancers, that's cancer of the ovaries, cervical cancer, which is something that is now gaining, people are now gaining more awareness of breast cancer and cervical cancer, because I feel now it should be a source of information to people now that when you are 35, you're advised to do what we call a pap smear. Okay,
What's that?
A pap smear. It's a test where something is taken, inserted into through the vagina, then a smear, like it's very small sample, is taken from the cervix, and then you take it to view it in the lab, and then see the cells in the cervix, if there are cells that are looking cancerous or they are looking healthy. So that was what we call a pap smear. Yeah, so it's something that helps women to get early detection. Ladies that are, because sometimes these symptoms come very late, so early detection is very, very key.
Very important.
Yeah, so we usually advise for women that are 35 years of age, to do a pap smear to help, and to do that every 5 years.
Thank you.
Yeah.
So we now have ideas on how to go about these things and how possibly to avoid them, not completely, but at least to an extent.
Yeah, to an extent, yeah.
Thank you very much, Dr. Odiri.
Yeah.
And that will leave me with one ultimate question. Between the men and the women, who has the higher death rate?
I think you know the answer.
To be specific.
Yeah.
At old age.
I think you know the answer.
I don't know.
At old age?
Yes.
I haven't really gone through the statistics, but I think we know the answer that generally between men and women, men have more death rates. And I think
why is it higher?
Okay, I think it's more of a social cultural
our activities.
Yes, social cultural mindset. For instance, one, I mentioned health seeking behavior. Men hardly go to the hospital except they are severely ill.
Yeah, to the point where people have to help them.
Yes, a woman might see something wrong in her during her period, and then she goes to the hospital immediately. But a man would have decided, I'll be fine, just maybe old age. You understand? So health seeking behavior is one. Okay. Then two, this idea that men are meant to hold a lot.
Rigid.
Yes, are meant to hold a lot, So be a man, be a man, bear a lot of pain, and move on despite what you are going through. You can see a man with a very high BP still, going to work because we take care of the children. So those are some of the issues that make it. It's not as if there's really any biological reason for a man to die earlier than a woman. Also, men engage in risky behaviors. Let's not just blame.
Yeah.
Men engage in more risky behaviors, like smoking. In the rehab I work in, the percentage of guys you see there and percentage of women, you can,
The equation is not
the
balanced.
equation is not balanced. There are more men smoking and abusing alcohol.
No, but when you say
Yeah.
risky behavior, I was thinking you were going to elaborate on our nature of hustling and all that.
That's part of it. Like men, the kind of jobs we do too. Okay, like you hardly see a woman climbing doing
Yeah,
a
women do
scaffold.
scaffolds.
Scaffold. She wouldn't do a scaffold, man. You understand? But men are willing to take that, because of so those are
It's all right.
reasons why men.
It's all right.
Yeah,
It's all right. It's a good one.
yeah.
Thank you very much for the awareness. And I hope subsequently with this knowledge we'll be able to guide ourselves as individuals, not as men or as women, but as individuals. And before we come to the end of today's episode, I would love to ask you our unfiltered ultimate question. What is that one thing you want to leave? One word for those out there.
Okay, it's more of a motivation, anyways.
Hit it.
And it's the quote that if you never try, you will never know. Yeah, if you never try, you will never know.
Is that your favorite quote?
Yeah,
Why?
because many of us are scared of failure, but for me, I think failing is not a sign that you are a failure. You get, and I feel there's more regret when you know that you could have been something but you never tried. So, for instance, there's a business you want to do, but you are scared that I might fail, and because of that, you do not do the business. Then later on, you find somebody doing that business, and so you now start thinking, maybe it's now almost too late. That regret, yes. So, one is try nonetheless. If you fail, good, it's a lesson. If you succeed, good, it's a plus to you. If you never try, you will never know.
That's a wonderful one. Viewers, we've come to the end of today's episode with Dr. Idiri, and it was very, very, very educational. We hope to see you guys next week with a more interesting conversation, something that would enlighten us some more. Do well to keep subscribing to our page Unfiltered, and should in case you need personal consultation, Dr. Idiri is the man for you. Dr. Odiri, rather.
Yes,
I got you right.
yes.
Dr. Odiri is the man for you. Thank you.